Welcome to another episode from the Veterinary Research Channel. I'm Elise.
And I'm John. Today, we're diving into some fascinating research concerning our feline friends.
That's right, John. We'll be discussing a recent study published in the Journal of Veterinary Internal Medicine in 2024. This study takes a close look at myeloma-related disorders, or MRDs, in cats.
Myeloma-related disorders. Alice? That sounds quite serious. Could you give our listeners a bit of background on what these are?
Certainly. The researchers, led by Lecot and Jeremy Begin, describe myeloma-related disorders as uncommon and not well understood cancers in cats. They mention that in dogs, the diagnosis of a similar condition called multiple myeloma often involves finding a high percentage of abnormal plasma cells in the bone marrow, along with other indicators like specific proteins in the blood or urine and bone lesions. Historically, these criteria have sometimes been applied to cats.
So, is it the same picture in cats?
Interestingly, the study points out that in cats with myeloma-related disorders, it seems more common to see involvement of organs in the abdomen, like the spleen or liver, without a large number of these abnormal cells in the bone marrow. In fact, previous studies have frequently reported infiltration of the spleen or liver and atypical plasma cell appearance in cats with these disorders, even when bone marrow involvement wasn't significant. The distinction between what might be considered multiple myeloma, which typically involves the bone marrow, and a condition called multicentric non-cutaneous extramedullary plasmacytoma, which involves tissues outside the bone marrow, is a bit blurry in cats because the disease often affects multiple systems. Therefore, for this study, the researchers decided to refer to both conditions collectively as myeloma-related disorders.
That makes sense, given the complexities. What were the main goals of this research?
The study had several key objectives. Firstly, the researchers wanted to describe the clinical signs, laboratory findings, and imaging results in cats diagnosed with myeloma-related disorders. Secondly, they aimed to detail how these cats responded to treatment and how well they tolerated it. Finally, and importantly, they sought to identify any factors that might be associated with shorter survival times in these feline patients.
That's crucial for understanding and managing this condition. How did they go about conducting this study?
The researchers conducted a retrospective study, meaning they looked back at the medical records of cats that had been diagnosed with myeloma-related disorders between January 2005 and June 2022. These records came from a total of 14 different veterinary referral centers. To be included in the study, the cats had to have an increased level of globulins in their blood due to the presence of an abnormal protein, which was confirmed by a test called serum protein electrophoresis. They also needed to meet at least one of the following criteria: a high percentage of plasma cells in their bone marrow, a smaller percentage of plasma cells in the bone marrow, but with very abnormal features, or evidence of plasma cell infiltration in their internal organs confirmed by tests like cytology or histology.
So they gathered a good number of cases to analyze?
They included 50 cats in their study. The researchers then collected a wide range of data from the medical records, including the cat's breed, age, sex, weight, any other health issues they had, medications they were on, their clinical signs, and the findings from physical examinations. They also recorded the results of blood tests, urine tests, imaging such as radiographs, ultrasound, and computed tomography scans, as well as bone marrow samples and biopsies. When it came to treatment, they noted the drugs used, the dosages, how often they were given, how long it took for the cats to respond, any subsequent treatments used if the first one didn't work well, and any side effects that occurred. Finally, they tracked the cats' outcomes, including whether they went into remission, how long that remission lasted, if the disease came back, and when and why the cats died.
That's a very thorough collection of data. What were the key findings of the study?
The study revealed some important insights into myeloma-related disorders in cats. All 50 cats in the study had high levels of globulins in their blood. Interestingly, involvement of the spleen was very common, seen in 86% of the cats where this information was available, and liver involvement was also frequent, occurring in 71% of the cats tested. In many cases, both the spleen and liver were affected. In contrast, a high number of plasma cells in the bone marrow was found in a smaller proportion, 63% of the cats where bone marrow was evaluated. Anemia, or a low red blood cell count, was reported in 67% of the cats, and a low platelet count called thrombocytopenia was seen in 34% of cats.
That highlights the difference between cats and dogs with these types of disorders. What about the treatments used and how well they worked?
The most common initial treatments involved a combination of melphalan and prednisolone, which was used in 19 cats. and cyclophosphamide and prednisolone, used in 10 cats. Other treatments included chlorambucil and prednisolone in 4 cats, prednisolone alone in 4 cats, and various other combinations in the remaining cats. The overall response rates to melphalan with prednisolone, cyclophosphamide with prednisolone, and chlorambucil with prednisolone were quite high, at 87%, 90%, and 100% respectively. However, side effects were more common with melphalan, occurring in 65% of cats receiving it, compared to 23% of cats treated with cyclophosphamide. The median survival time for all cats in the study was 122 days. Interestingly, the study found that the specific chemotherapy protocol used initially did not significantly affect how long the cats survived.
So, while some treatments were effective in getting the disease under control, the long-term prognosis was still guarded. Were there any factors that the researchers identified as being linked to shorter survival times?
Yes, John. Through their statistical analysis, the researchers found that anemia and thrombocytopenia at the time of diagnosis were significant risk factors for shorter survival. Cats with anemia had a median survival time of 89 days, compared to 356 days for cats without anemia. Similarly, cats with thrombocytopenia had a median survival time of only 22 days, while those without it survived for a median of 156 days. These findings remain significant, even after considering other factors like low albumin levels and a low albumin to globulin ratio.
That's a really important finding for veterinarians treating cats with these disorders. Now, let's move on to the discussion section. What were the researchers' interpretations of these results?
The researchers began by noting that their findings regarding the clinical signs and laboratory abnormalities were consistent with previous studies on myeloma-related disorders in cats. They reaffirmed that visceral organ involvement, particularly of the spleen and liver, is more common than extensive bone marrow involvement in cats with MRD. They emphasized that even if bone marrow plasma cell counts are relatively low, but the cells show abnormal features, and there is evidence of organ involvement, this should still raise suspicion for MRD.
It sounds like the diagnostic criteria for cats might need to be more focused on these extramedullary findings.
That's a key point. The study also supported the good tolerance and response rates associated with cyclophosphamide treatment, aligning with previous research that considers it a first-line option for MRD in cats. While melphalan also showed a high response rate, it was associated with more side effects, particularly affecting the bone marrow. The researchers noted that the lack of a significant difference in survival times between the melphalan and cyclophosphamide groups could be due to the relatively small number of cats in each treatment group.
And what about the prognostic factors they identified?
The finding that anemia and thrombocytopenia were linked to shorter survival times is novel for cats with myeloma-related disorders. While anemia is a known negative prognostic factor in humans with multiple myeloma, it hasn't been consistently reported as such in dogs. The researchers suggest that the worst outcomes in anemic and thrombocytopenic cats might be due to severe bone marrow infiltration by the abnormal plasma cells, blood loss, or other underlying issues. Thrombocytopenia, they point out, can also be associated with other serious conditions that could worsen the prognosis. They acknowledge that their study, being retrospective and involving multiple centers, had some limitations, such as variability in diagnostic testing, treatments used, and follow-up. Also, the assessment of response to treatment was primarily based on blood globulin levels, and more advanced techniques used in human medicine were not routinely employed.
Despite these limitations, it sounds like this study provides valuable new information. What was the overall conclusion?
The researchers concluded that myeloma-related disorders in cats often present with liver and spleen involvement, rather than significant bone marrow plasmacytosis, and carry a poor prognosis. While cyclophosphamide and corticosteroids appear to be a well-tolerated initial treatment with comparable survival to melphalan, further research is needed with larger numbers of cats to confirm these findings. Importantly, their study identified anemia and thrombocytopenia at diagnosis as significant and independent indicators of shorter survival times, suggesting these could be important markers to consider when assessing the prognosis for cats with these disorders. They recommend further studies to validate these prognostic factors in a larger group of cats.
This has been a very insightful look into myeloma-related disorders in cats. It's clear that further research is needed, but this study provides a valuable step forward in our understanding of this complex condition.
Absolutely, John. It's crucial for veterinarians to be aware of these findings to better diagnose and manage feline patients with myeloma-related disorders.
Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.